As we reflect on the year, it is difficult not to feel a sense of pride and accomplishment in all that we have delivered at North Tees and Hartlepool NHS Foundation Trust. Of course, it has been a challenging year yet again in many respects, professionally and personally for our own staff. For our patients, our focus has been firmly on recovery, ensuring that our services are at their optimum post the pandemic, to continue to give confidence to our communities, and of course, to support our continued ambition for positive population health. The pandemic helped the NHS to focus quickly in responding to a virus like no other we have seen in our lifetime, from our infection prevention and control measures to the speed of development of both the vaccination and our own vaccination hub. Staff health and well-being became more important than ever before, and we were so overwhelmed and continue to be so by the support and generosity of our local communities. In terms of our practical service developments and delivery, there is much to celebrate. Our Healthy Lives Care Group has employed new technologies and procedures that have enabled movement of gynaecological procedures into outpatient settings, resulting in reduced recovery times for our patients. And our Under 5s neurodevelopmental pathway has been a hugely important piece of work for the organisation. Our responsive care team have undergone significant landscape and environmental changes that have delivered positive impact for our patients and our staff. From our remodelled emergency department footprint to established capacity, which has ensured sufficient segregation of patients, and reducing risk to infection control to our joint appointments across the Tees Valley within our emergency departments. Both North Tees and Hartlepool and South Tees Hospital have benefited from several ED appointments that benefit patients and staff. Significantly, the development of our respiratory support unit, RSU, to accommodate enhanced respiratory care has evolved the way we deliver for our patients. The £2.5 million modernisation of Ward 24 provides a significantly improved environment which addresses infection control and isolation challenges, smart glass technology and central telemonitoring and alert technology. A real success for the Tees Valley. Our collaborative care team have made significant developments in secondary pain management with the introduction of the IMSK model. More partnership work with our colleagues at South Tees Hospitals has seen the introduction of a hot stone pathway, which has brought a huge benefit to our communities across the Tees Valley. Collaboration continues to be at the heart of what we deliver. The Trust has seen significant service developments yet again, and we continue to innovate. Our organisation implemented digital pathology, which has enabled remote reporting. Using the National Pathology Exchange has allowed us to provide resilience throughout the pandemic and beyond, supporting off-site referrals to other labs in our region, allowing results to be electronically returned and automatically issued to requesting users. Our rapid diagnostics pathway has offered patients assurances of swift investigation for those with non-specific symptoms to ensure early diagnosis of cancer. From a staffing perspective, we continue to strive to be a destination employer. We want to attract and retain the very best talent. Ensuring our colleagues remain fit and well is a key priority, and we have worked hard to ensure that the co-administration of both the influenza and COVID-19 vaccinations works seamlessly. Our health and wellbeing focus has become central to our support for our colleagues. Our psychology, chaplaincy, occupational health and people development work to ensure staff feel supported and have a space and a voice. Technological developments such as Yellowfin, a business intelligence software, gives us greater insight at pace into our trust position, and our new ICT help desk was implemented across the trust, giving staff wider access and oversight to the requests they have made. North Tees and Hartlepool NHS Foundation Trust has long held ambitions for positive population health, achieved by true system working with partners, agencies, organisations and wider community groups. Our performance remains one of the most positive in the country, and we continue to be highlighted as thought leaders and innovators within our sector. The work continues.